welcome back to Better Living. I'm here with Pam from Dr. Frankel's office, Frankel Dentistry. I'll get it all out. I've heard something that's very weird for me because I'm a nervous dentist person. I'm going to tell you, I have some anxiety about going to the dentist. But you say that a lot of patients actually look forward to coming to Frankel Dentistry.
It happens.
Why is that?
It happens over and over again. And dental anxiety is very common, so don't feel
I'm
like
not
it's
alone?
a rare... No,
Oh,
it's
good.
probably 1 in 3 people. And it usually is based on something you heard earlier or experience you had. It might not even be a dental experience. But what we have found over and over again is coming to our office, people enjoy it so much because we explain everything, we listen to you, we make it more of a spa-like situation where you feel like you're at home. We feel like you're a dental family. So we have patients that say, is it wrong? I look forward to coming to the dentist. We also offer, we'll have an anesthesiologist come in. So if someone feels they need to go to sleep during treatment, we can do that.
That would probably be me if I needed, yeah.
Interestingly enough, afterwards though, they don't need it anymore. And they go, why did I do that? Yes, per person. They come back and go, no, I really don't need that. I don't know why I did that.
Well, that
so
is
it's interesting.
That making people comfortable is so important. And I would think the fear of the unknown is probably a lot of the concern. And so just by talking through it, that makes a huge difference.
And dentistry has changed so much over the years. There's so many things that are updated and people understand that. The technology in dentistry is just astounding.
It is remarkable what you can do. Now, we just talked about with Dr. Bob it being National Dental Health Month for dogs and cats, and he was talking about the health concerns, you know, what happens if you don't get those teeth taken care of. And that's the same for people, right? There is a correlation between dental health and your overall health.
Yeah, a healthy body promotes a healthy mouth promotes a healthy body. There are so many things associated with your oral health. Heart attack, stroke, diabetes, pancreatic cancer, Alzheimer's, low birth weight in babies, miscarriage, all associated with the healthier mouth. If you're going in for open heart surgery, if you need dental work done, it needs to be done before the open heart surgery. It affects your overall health that much. What happens is, and it really makes a lot of sense, you have a low-grade infection.
Okay.
So your body's fighting infection, and that lowers your resistance. The bacteria gets into your system. And so that's where you have the systemic effects.
See, now that makes sense to me, but I've never heard that explained to me before.
And I've heard, I was at a seminar one time and they said, if you had bleeding anywhere else in your body, you go to the doctor.
You would, but we don't think about it in our mouth, do we?
It's not normal to have a bleeding in your mouth. And it's 4 inches from your brain. So
that's a good point.
It's really
And I've never thought about that. I mean, because you brush your teeth, it's not uncommon for you to have some bleeding in your mouth. And honestly, I've never thought about it.
It's not uncommon, but it's not healthy. Healthy mouth does not bleed.
That is good to know. I'm going to pay more attention now. Let's talk about smile makeovers. It makes such a difference to people's self-esteem, how they feel about themselves, and whether or not they're going to smile.
It is the most gratifying thing we do. We have patients who cannot smile. And so people respond to you by the way you look and react. And if you're hiding your smile, it may appear like you're trying to hide something. You're not telling them something. So with our smile makeovers, and the amazing thing is we can do this in just 2 weeks.
Wow.
So you come in, we'll analyze your smile. We'll do something called a wax mock-up. And so you can kind of see what your teeth are going to look like. We follow the lip line. We make it so natural that to a person, our smile makeovers, people say, did you change your hair?
They have no idea what it is.
They have no idea it's their teeth. And so that it totally changes their mouth. They come in, we will prepare the teeth, put the provisionals on, and then 2 weeks later, we seat the permanent, in this case I'm talking about veneers, permanent veneers, and you have a new smile.
It's
so much fun.
Gratifying would be the correct word.
So much fun.
Very rewarding to see people actually smile and feel good about themselves.
And they say, why didn't I do it sooner? Person after person.
Well, speaking of doing it sooner, if you're a 20-something and you know, obviously have all your permanent teeth then and you don't like your smile, you think about coming in to do it, but am I ever too old to get that done?
No, not at all. We've had 80-year-olds do it, and it really changes the quality of their lives. You know, the good thing to do, if you're thinking about it, and you want to know, well, is that something I really want to do? We do digital imaging.
So you can see.
You can absolutely see it. Come in, we'll explain what the procedure is, and we'll do a photograph, a before and after photograph before it's done. So that's a wonderful thing with technology. You can see what it looks like.
That would be great, because I think that's probably a fear people have. Oh my gosh, what if I look like I have fake teeth? What if it makes me look funny? But if I can see it before I ever do it,
Well, we're really cautious about making it look natural. There's something called a golden proportion. It's in nature and it's in architecture. It's really interesting. It's a length and width of teeth of one tooth compared to the other, so it cascades by 2/3. So when you have that golden proportion, the smile looks so natural. And people look younger, they're happier, that people respond to it. We actually have a patient who won the lottery. This patient won the lottery. And if you ask, what's the most important thing that's happened to you in your life? Their smile
makeover, not the lottery.
Not the lottery.
That's hilarious.
That is hilarious.
Well, I mean, if I say I really want to have this done, how quickly can I get in? How available is that? I mean, am I going to have to wait months?
No, because it is an emotional thing, we will make it happen right away. We will do whatever it takes to see you as soon as possible. Something that means that much to people, and we know that because we see it over and over again. We will see you right away, and we will get it done as soon as possible.
I think that is a fantastic thing. I think everybody should have that done because it really makes all the difference in how they feel about themselves.
It does, and then they give to other people. We have one patient who talks about that, how her smile is a gift to others. Which is an interesting approach to it, that she can tell that people are happier around her,
Sure.
that she's more open to them, she's able to talk to them more than she did before. So she's offering more of herself because she changed her smile.
It makes a lot of sense. Well, if you're ready to change your smile or you just want to make sure those teeth are healthy because you need to, it makes a difference to your overall health. We're talking about Wear Red Day and heart disease. That's the first place to start with a healthy mouth. Give Dr. Frankel's office, Frankel Dentistry, a call today and get in for that smile makeover. We'll be right back in a minute.